primarily in property and casualty. How has the pandemic affected the way you do business?
It certainly had a major effect on my business. But in the property and casualty business, obviously, some different times I do a lot of small business insurance, and the business interruption coverage has become a major concern for business owners with a governmental shutdown, and all policies seem to have a little bit different language on it. We've had to do a lot of talking and working with our small business people to help them understand what's going on with that. And I think in the future, you may even see some language that will amend the definition of business interruption. What triggers business interruption protection now basically has to be a fire, theft, vandalism, those types of things. But the governmental shutdown from the CV-19 is a new thing. We haven't had that to experience that in many, maybe 100 years or more probably. And so that's an area that's going to be discussed by the insurance companies and by a lot of consumer groups as well. And communication just with everybody. I mean, all our people are concerned about what's happening. People that lost their jobs, don't have an income stream coming in. We've had to do a lot of talking with those people. We've with the estate payment moratorium that was put in to help people not lose their coverage if they can't make their payments when they come due because of the problems that we're having. We had to do a lot of work with people there to try and restructure payments and just really spend all our time taking care of our customers, which is what we do ultimately, but it's a different kind of taking care of our customers. It's hand holding, it's telling them it's going to be okay. It's trying to help them get the right information, apply for the government assistance payments, PP checks, those types of things. And we've had a lot of people listen to the NAIFA webinars on those types of problems, and NAIFA National's done just a wonderful job of helping get information out for people to be able to apply, and probably is going to ultimately save some small businesses just from the fact that we had our NAIFA resources that were able to get the good information out. So those are the kinds of things we have. I'm such a face-to-face live person. I've had to adjust to doing things with Zoom, tons of things over the telephone. And I'll look forward to getting back to where we can sit down at the kitchen table and work with people that way. But we're pretty adaptive creatures, humans, and we can get these things done. And our companies are doing some different things to help make that happen. Signatures can be done electronically more easily now than what they could in the past. And so there's some good things that are going to come out of this, all this turmoil that we've been in.
Hey, thank you, Andy. Andrea, you specialize in health insurance. Obviously, the pandemic placed your segment under extreme pressure. Can you share some of your experience with us?
I'd be happy to. Thank you for asking. Never in my lifetime has health insurance been such an important discussion as it has been the last few months. We often joke that young people in their 20s rarely see the need for nor the justification for the cost of health insurance. I think now everyone young, old, and in between is concerned. Most, if not all, medical insurance companies sent word that COVID-19 testing and treatment would be covered at no cost to insureds. I'm sure your experience is similar to mine, that you received what seemed like 3, 4, 5 emails a day relating to that till it was almost nauseating. But I would like to focus on one aspect of health insurance coverage with people's jobs up in the air in many places. Just a side note that when I talk about the marketplace, it's what most people refer to as Obamacare. Employers are having to make tough decisions about employees due to loss of income. Normally, you cannot apply for health insurance through the marketplace except during open enrollment, November 1st to December 15th each year. However, if you have a special enrollment period, which we refer to as an SEP, then you can. Certainly losing health coverage through an employer is an SEP. Those plans always start on the next first of the month following loss of coverage if you apply timely. A person has a basic 2-month window to make an application or that SEP goes away. There was a time when opting for COBRA was just as affordable and people could get individual plans for much less cost. Now accepting COBRA is definitely in the conversation because of the high deductibles and out-of-pocket maximums as well as the cost of the marketplace plans. There are a lot of factors involved in taking or not taking COBRA. True, all pre-existing conditions are covered under the marketplace plans, but the COBRA plan may have lower out-of-pocket costs for services. Plus, the network of doctors and hospitals is almost always a national one. This is especially important if someone has an ongoing medical condition with expensive treatment. Most of the marketplace plans have smaller, localized networks with no coverage if you have services outside of its network. This is definitely the case here in Southern Indiana. Under certain financial or income circumstances, the marketplace plan premium may be reduced. This is based on taxable household income, among other factors. So the best thing to do if you or any of your clients need to make health insurance choices is to get in contact with an agent or broker who understands how things work and will help navigate through all the choices and the decisions that need to be made. So this is coming up quite a bit in my practice now as employers are having to lay people off. So that just gives you a little bit of insight in case one of your clients should ask you a question as to how all this will work. So hopefully that's been helpful to you.
Thank you, Andy. Greg, has the pandemic affected the members of the society in general and your practice in particular?
What we've done is we have reached out to our members and canvassed them to determine, their timing and comfortability as far as meeting in a group. And so until that time, we've been meeting virtually and have some additional things that are planned along those lines. And what we did at our office when this first came about, we first determined how to restructure our work process. And first step was determine who had the capabilities of working from a remote situation and those people who did not, making sure they had equipment to be able to do so and fostering that. Then developing new processes to help get documents in place for people. Actually had some instances where people who were wanting to get updated estate planning documents in place, we just arranged to actually meet at my house a safe distance outside and had a table set up for them because they wanted to get things in place, and had my assistant come over and meet, and we were able to do that. And those were mostly people who were in the healthcare field that were concerned and wanted to have things in place. And so we wanted to help them do that so they didn't have to worry about that. With others, if we didn't need to sign or execute documents, we did some virtual meetings. And we've also taken advantage of the electronic filing aspect for real estate documents, because there are some systems in place that you could do that and scan electronic copies and send that. So all things concerned, we've tried to keep things moving to help address people's needs. But it has definitely been a challenge. And, I'm looking forward to when we can get back to meeting with people face to face.
Thank you, Greg. Carol, you're an expert on long-term care. We know that a large percentage of the COVID-19 fatalities occurred in nursing homes. What have you and your colleagues at LECP learned from this?
Well, good morning, everyone. And first, thanks to the team at the Indiana chapter for inviting me to participate. Frankly, I'm kind of flattered to be with so many distinguished guests. Well, for us, COVID-19, which is very visible, speaks well to what we consider kind of the invisible, which is planning for the extended and the long-term care. We at LECP see this as like an LTC tsunami. You have an aging population, you have longevity, and you have a shrinking birth rate. Well, this is the first time with people being shuttered in that they've had to deal with taking care or not being able to reach into the nursing home or provide any kind of support. And I think that has left them with a completely different feeling towards, we didn't plan for this, which could be very significant for long-term care. And then the other thing that was visible, which it's very hard for any of the LECP sponsors to communicate and not sound negative about the scarce and the poorly funded, inadequate facilities, or frankly, the terrific shortage of qualified and trained personnel, right? But here they're seeing it on television, on Facebook. So the entire topic, which is sad and which is difficult, has led to them being more aware of, let's say, the caregiver support ratio, with more people needing care, few people being able to do it, and then seeing the impact of the shuttering of businesses. The third thing we noticed at LECP is that when people couldn't go to work, it was the first time that they kind of experienced what it is to not have planned and then have to be the caregiver. So they couldn't go to work. So there were impacts on them emotionally, physically, financially, psychologically. That also led to us talking about the impact on personal retirement savings, diminished career opportunities, and all the things that come with having to stop what you're doing because you didn't plan to become a caregiver. So for LECP, we've designed the site so that other insurance professionals who don't look at long-term care as their specialty, along with top decision makers, because, you know, for example, ASH is one of our major founding sponsors, which we're very proud of. The sales professionals, vendors, we have purposely designed it to have various options instead of just one option, because obviously, I think this COVID, sadly enough, has really made everybody see the challenges of having to stay home, not work, not being able to be satisfied that your loved one's in an adequate nursing home. And if you had planned, this may have been a very different situation. So in the future, what I see is the industry is going to have to, in view of what's happening, get more inventive in creating products and services. And I have to tell you personally that yesterday and last week, I was consulted by two new carriers, or they're not new carriers, but they're creating new products. And I think we can talk a little more about that later. Thank you.
Thank you, Carol. I'm going to jump out of sequence because I think we need to follow Carol's discussion with comment by an elder law attorney. Jeff, what have you seen in your practice during the pandemic that has caused you to rethink the way you...
Well, thank you, Joe. Yeah, like many businesses, our first few weeks in the pandemic were kind of chaotic as we, adapted to the new data that was coming out and adopted new processes. We never closed our office because we wanted to provide some reassurances to our clients that we were there, but we almost immediately implemented a kind of a rotation among staff. We didn't have any more than one person in the office. We're now back to everyone being here, but we still have adjustments. The Supreme Court has helped us out along the way in that it has provided some emergency orders that have allowed us to do kind of witnessing of wills by video, depending upon your interpretation of their guidance, also notarization of certain documents by video. But the big thing we still, I guess we say struggle, but maybe more better word is cognizant of is, we represent a vulnerable population that is either the vulnerable person or 1 degree away. So we still want to be as careful as we can for folks. So we're still distancing. Video conferences are preferred. When we absolutely have to meet with someone to sign documents and the like, we're all wearing masks in the office. We're keeping distance. We're discouraging folks from bringing more than just themselves to the meetings. Well, if they want a family or a friend to be involved, we'll invite them to be involved by video. But I'm handing out lots of pins, so everyone gets their own pin when they come in for a signing, for example. We have obviously sanitization and gloves available, and of course we're spending time wiping down the entire office between clients. So that's how we're adjusting. I've kind of seen this really though as an opportunity. resisted video conferencing in the past when folks have asked, that I really kind of like it. I'm a very visual presenter, so telephone I've never been a fan of, but this has kind of helped with this because I can share screens and just kind of say, this is what I'm talking about, and help folks kind of understand some of the complex issues that we're detailing there. So I'll piggyback on one of the things that Carol had mentioned, and that is we're doing our best to focus on non-institutionalized education of services. So doing a lot of education on home care options under public benefits, for example, educating family caregivers on how they can be compensated, particularly if they've recently lost a job, and how, you know, mom and dad can compensate them to make up for that loss of income. So those are kind of the things that we're doing. I guess the unfortunate thing I've seen, though, is a great increase in deceased estates here recently, just because I'm losing a lot of clients to this disease. So that's kind of what we're doing in a nutshell.
Hey, thank you, Jeff. Mike, you speak all over the country, and ASHA is one of the largest and most diverse brokerages in the country. How has the pandemic affected the way ASH does business? And on a side note, what challenges is the society facing nationally?
Thank you, Joe. I think that we looked at the pandemic from an ASH brokerage standpoint as an accelerant to change and not an impediment to change. One of the nicest things I talked to our advisors about is ASH brokerage had just completed its annual business continuity plan testing in January and February. So as we headed into the pandemic, we were really confident that we would be able to maintain our service level standards, and we certainly could. I think that's a best practice for everybody to take a look at. As a financial professional, we need to instill the confidence with our clients about our ability to continue operations as a result of any catastrophic or black swan event. So I encourage everyone to test and stress test all of their at-home remote working things, their VPN, all of their CRMs. It's a best practice that we've done in the 7 years that I've been at ASH brokerage, and it certainly paid dividends for us throughout the pandemic. The other significant change that we've done is we've transitioned to what I refer to as a Netflix mentality, and that is certainly growing at the consumer level. Consumers want to consume their information on demand when they want it, how they want it, and on what device that they want it. Therefore, we have deployed a lot of 2 to 3 minute videos that our advisors and then ultimately their clients can use. We have transitioned, just as Jeff said, to a Zoom in a virtual world. We're actually creating and filming some client-approved seminars that can be on demand so that producers can use that. They can moderate that throughout the client seminar and things like that. Those have paid dividends throughout the dividend. Anecdotally, we get really positive comments, but more than anything, what we're finding is that in March and April, our fixed indexed annuity production was 33% better than industry averages. And year to date, we're 34% better on fixed indexed annuities. Entire fixed, indexed, and income portfolio, which we wholesale, we're 24% better April over April. So those things that we're doing to educate advisors on demand has really been paying dividends. Clearly, the insurance industry is changing with technology. From a life insurance standpoint, we're down to 17% of our applications are paper. 71% were e-submitted in April. And that was just 39% across all business lines in the fourth quarter. We've actually decreased our placement time by less than 10 days by going to a digital e-submission type of setup. From an underwriting standpoint across business lines, I think there's a couple things. First of all, on a DI side that our business line leader asked me to talk about is that many carriers have raised the simplified issue limits. Typically, you saw that right around $6,000. That is now up to about $10,000, and some of those DI carriers have enhanced their drop tickets, so it's actually a little bit easier to go through that process. From a life standpoint, we're seeing a lot more people using accelerated underwriting. That went from 22% up to 48% in April. There's been a lot of use of electronic human records here at Ash Brokerage through our human API. And we're also seeing higher face amounts with reduced requirements. Many carriers are looking at ways in order to use physicals as an example if it was something recent. So those are some of the changes that we're seeing here at Ash Brokerage. Overall, again, I think that the pandemic, we viewed it as an accelerant to grow our business, and I encourage everyone to think about some of these changes are very systemic and will last for a long time, will actually better the client experience when you're buying life insurance and things like that. From a society standpoint, we're seeing very similar numbers. We're working at a national level. About 90% of the employees are working remotely fine. The only people there in the office is IT and support. At a society level, we're seeing 6 times the number of our archived webinars being downloaded. And we've also launched a new fspgo.com website where every individual, whether they're a part of the society or not, can log in, get good information from the society, tap into our resources of education. You can buy the journal, which is one of the most highly publicized publications in the financial services industry, through fspgo.com. So again, it's just another way to touch the society during the pandemic. And those are the things that I think have been a material shift for us.
Thank you, Mike. That was very enlightening. We're now going to move to the free-form portion of our discussion. So speak up on any idea you think pertinent. Free interchange is encouraged. I'll be taking questions from our audience, but let me start by asking a question of the panel. Any and all of you can answer, but please one at a time. Again, our attendees can ask a question by raising their digital hand and typing their questions into the chat window. So for the panel, what do you think is the biggest challenge for the financial services industry for the remainder of the year, and how do you think it should be addressed?
Just as a general industry, I think some of the things that are systemic in terms of getting e-signature, I think that from a retirement income standpoint, we really have to be much more client friendly to move money through 1035 exchanges, qualified transfers electronically. That's still a very much wet signature process across the industry. We need to get some standards, and we need to be on an equal playing field with mutual funds and other securities related instruments. That would be from my standpoint, from a retirement standpoint.
I think we definitely, with some people having some reduced incomes from being off work, it's going to be an excellent time to be looking at some Roth conversions. Sure that, because we know from our friend Van Miller, the taxes are still on sale. With all the money that we've printed and all the debt that we're assuming, we know that taxes are never going to go down. And this will be a good opportunity for some people to do that rollover into a Roth product to avoid those taxes down the road.
Good idea, Andy. Thank you. We have a question that has come in from Sheila Ressler. Her question is, we all know we must be ever more vigilant with respect to possible cases of neglect or abuse, emotional, physical, financial, particularly with elder clients and anyone with special needs. Now that so many more are homebound, how are each of you remaining or getting more connected to have our ears to the ground on this?
This is something that I'm continuing to chew on because I do have some concerns here. Even with video conferencing, I don't know who may be in the background of that camera, and I always make sure we've asked the question and we go through attorney-client privilege and who has the privilege, which is the attorney, and who is not privileged in that room to make sure that they understand. But at the end of the day, I don't know if there is somebody being influenced in the back, and that bothers me. So it's being vigilant with trying to check in with clients, trying to check in by video, watching body language, but in past that, check the smell test. I always, I'll on occasion will get someone in my office who says, boy, mom just wants me to have everything. And, you've got the smell test there. And that gives you the opportunity maybe to try to maneuver around that person to get a hold of the client, your long-standing client, and just have a discussion. So be vigilant, check in to as many different forums as you can, and just kind of keep use your internal radar.
I'd like to say something, and I may not be focusing exactly on your question, Sheila, but I've experienced with my parents how isolation can make such a difference. And I think if we can have any kind of contact, whether it's a letter, a phone call, or as you mentioned, a video chat, those are so important to keep people in contact with somebody, with another live body, I guess I should say. So that's something that I'm trying to do for those of my clients who I know live alone and are experiencing that isolation. I'm trying to at least once a week or once every 2 weeks, just check in to let them know that somebody is thinking about them.
I have to say that the sponsors at the LECP have really stepped up in terms of providing information to advisors. LECP is open to anyone. It's not just for the members of LECP and of NAIFA, because they're putting out quite a bit of information to consumers as well. And the reason we're trying to do that is somewhat like Andrea said, to help people feel that while they're seeing all of this and feeling all of it, none of which is very reassuring or pleasing, that we are giving them information that is positive. What should you do? Obviously, one of the things we encourage is contact Andrea, contact Jeff, contact Ash for all of the tools that they have to start conversations and to stay informed about what's happening. So along that line, I think LECP has really stepped up. Most of the sponsors are sending something at least twice a week. Either they're arranging it thematically or just something they feel is responsive to helping people through some of this isolation and to, frankly, encourage planning, because that's why the word planning is part of the LECP name.
Okay, I have another question. With so many deaths in nursing homes, many are predicting a surge in long-term care insurance sales. What is your opinion on that?
I think a lot of us realize that, part of the job of the advisor, the agent, or the professional is to make sure that they understand what they can do, and that they, as Jeff said, they have the right to really good advice. So one of the things I think is important is to find out who they're talking to. I always encourage people to listen to their story. They probably know somebody, or most of us have had experiences ourselves. And I think that is a way of finding out what's the right product or option for them. Because one of the things, again, at LECP is we have options for insurables, but we also have options for people who are not insurable and still need to plan and still need to have some kind of idea of how they would handle it. So I do think there will be a surge in long-term care as well as extended care. I think many of the hybrids that kind of sing that twofers tune are attractive. And as I mentioned earlier, I have had 2 carriers contact me to ask me about certain riders that they're thinking of adding. I think there'll be a surge, but I also think there'll be more creativity in the products that people will be talking about, in products that various vendors, carriers, and other related areas. Because nursing homes are, frankly, it's not a place any of us wanted to go before COVID-19. So I think given that it's top of mind, if you will, I think you will see a surge in people at least starting into the planning process, which should lead to more options, solutions, and sales.
Another question for the panel. Have the partnerships that you have established with other practitioners, have they changed during the pandemic? And how do you see those relationships working in the future?
I will just say, I don't just partnerships, but just talking with friends of my firm alone has been more difficult. I'm not going to mix words. My business is way, way down. And I think a lot of it just has to do with folks just aren't congregating like they used to. So they're not hearing those stories of my mom needs some help, or we're looking to protect our farm, or things like that. So my name's not getting out there. And so it is a challenge. I'm a part of a few really good networking groups that we haven't met in months now. So I've been doing some virtual coffees, which has been beneficial, and things like this has been helpful as well. But it is an adjustment, and I think a lot of us are still kind of feeling that part out. My guess is, at least I can say from my own personal perspective, I've kind of sat back thinking, well, this will subside soon, and we can get back out and have lunch together in the future, or just have a coffee in the morning. But so far, it just hasn't happened. So I think we may have to look at different ways for us just to all stay connected.
I have a question for Greg Cagnasola. In light of the pandemic, what is your approach to pre-planning funerals as part of an estate plan?
That's a very good question, Joe. That's something that I always like to touch on with people for two reasons. One is it's something that you see the loved ones who are left behind always struggle with if that issue's never been discussed. And it can give the people a lot of peace of mind to know what they need to do to implement it and to go ahead and do that. Because I think, fortunately, funerals and weddings are two areas where people can spend probably a lot more than they need to. And if you can give input as the decedent as to what you want done and have it all prepaid, that's one less stress point for the family. And so if they know what they want done, I encourage them to go ahead and arrange that. And then it's one less thing that the loved ones who are already coping with the loss of someone that they love don't have to worry about, and they can just worry about kind of helping the family and dealing with the other issues.
Andrea, how challenging was it to help your clients with their health insurance, especially the claims during the pandemic? And what changes, if any, do you think you'll be making to your practice based on your experience over the past couple of months?
The way claims are processed now, it really doesn't involve us agents unless there is an issue somewhere. So that's pretty much been business as usual. The way I see my practice changing a bit, just going back over the last couple of months, it's been a challenge for me working from home. I've never done that. It's so inconvenient to need something that's in the office when I'm at the house, or I left something at the house that I need at the office. But I think it's helped me to get more organized, and I think that's going to be a positive factor going forward. As far as health insurance, it seems to be progressing like it always has been. I'm getting the same amount of calls as I did before. People are aging into Medicare, and then they're leaving jobs or contemplating retirement and want to know what their health benefits will be. So from that standpoint, that hasn't changed a whole lot. I like the idea of being able to get back and see people, just like it would be such an advantage for us to be able to see each other this morning. It's the same kind of thing with your clients. You just don't feel that connection as much as you do when you can interact with someone in person. And as we all know, the way we get and retain business is by forming relationships, and it's somewhat difficult to do that through email or through a phone call. So that's something that I'm looking forward to going back to. Yes, that's the old way, but I'm going to have a greater appreciation for it now than I did before.
Andrea, you mentioned as you were just speaking that some of the clients are aging into Medicare. Do they ever ask you about what kind of coverages they'll have if they wind up, especially now with them seeing, it's top of mind, all this business with nursing homes and facilities, et cetera, hospitals. Do they ever ask you about extended care and would this cover it, or the impact of, let's say, both of them are collecting Social Security, one of them passes, and of course that diminishes the income. Would that have an effect on Medicare and what kind of coverage they might need if they needed extended or long-term care?
It doesn't always come up, but I try to, as we're going through the outline of coverage, talk about what skilled nursing means as far as Medicare. And a lot of people have a misconception that that's long-term care. I do address that on occasion. I should be more diligent about that. People tend to focus mostly on the medical benefits because they're coming off of an employer plan or an individual plan, and that's what they're looking for, but that's a very important component of that. So I'll try to be more diligent about that.
I have a question for Carol and Jeff to follow up, since we are touching on long-term care. You are both aware of the problem of understaffing in Indiana nursing homes and the recently exposed diversion of billions of dollars intended for nursing home patient care to upgrading hospital facilities, which was an article in the Indianapolis Star recently. How do you think that will affect long-term care planning in the future?
One of the great trends I've seen over the last several years is more funding going into home and community-based alternatives to institutionalization. I always say I've had one client in 21 years say, I want to go to a nursing home. No one wants to go to the nursing home. And that one client simply wanted to go because her son had been there for several years and she wanted to be with him. Being that few people even want to be in a nursing home, I think home and community-based alternatives are the next step, the next trend. And we've seen more funding from a public benefits standpoint go into those. And in fact, I would say I probably have had more folks that have come to my office in the last couple of years that have needed crisis planning, where we have planned for some alternative, whether that be assisted living or home care or adult daycare versus institutionalization in a nursing home. So I think this may just be a continuance of that trend, and I hope it is as a substitute for institutionalization being something outside in the community.
I would agree with Jeff. I would say that, I'm seeing that nursing homes are going to be forced now to do something called crowd scanning thermometers and what have you. And I think most of the products that we'll see speak to care in the home. Now, we know that for the states, they very much want people to age in place. And of course, that's one thing to do if you have adequate staff and nurses' aides who can come into the home while, say, you're working on the farm. People have to come in during the day, or they can get someone to do it. And I think in a lot of cases now, just in general, these nursing homes are going to find themselves under a tremendous amount of scrutiny because of what we have seen. And 22 states have already, as of January 1st, 2020, they have instituted that everyone has to get a certain amount of pay, which I'm thinking is not the norm with some of the nursing homes, especially if they're pulling funds off and putting them, as this article indicates, into hospitals rather than nursing homes. So I would agree with Jeff. I think the movement has been and will continue to be adult daycare centers, homes where they have, and many of them have been successful, 6 people and 2 people taking care of them, because it stays within the community. And I think we will see that very much continue. So I would say that the fact that you're going to have minimum wage, the fact that you're going to have increased regulations on nursing homes, increased labor costs, record keeping, I would think at this point that most of these nursing homes are going to have to be absorbed into the community, maybe morph into something else, or I would hope so.
Thank you, Carol. And we've got another question. This one actually from George Buter. His question is business protection from COVID-19 liability suits.
And the reason I put that in there is it's a whole new area that we have to worry about. If somebody does contact the virus, says it was a fault of your business, how are you protected? The client comes into any one of your offices, and are you taking the proper protections that the local health departments and the authorities are saying? If you're doing that, your business liability insurance will protect you if you get sued for somebody catching the virus through or allegedly through your business. And all policies will cover that. That's kind of a base. It's in every business policy. The other side of that is, though, is that if you're being kind of flippant and not trying to do due diligence by wearing masks and sanitation and social distancing and trying to do all the things that you're told to do to be proactive to try and avoid it, business will probably be, it will be protected. Your policy will protect you, but just know that be prudent, do the things that you need to do, that the health departments, that the authorities, public health authorities are telling you to do. Then your business insurance, nobody's going to cancel you or have a problem with renewing your business insurance if you do have some claims and some suits are paid out. But if you're not trying to be diligent, then you can have a problem with sustained insurance down the road.
With that, we are a little over an hour into this, and we've come to the end of our program. I just want to make one comment. One, I think this has really been a time for our industry to shine. We have stood by our clients. We have innovated and changed to help our clients and to help our practices and to help each other. Very proud to be part of this industry. Thank you for the panelists, your insight and discussion. I gained several pieces of information from it. I'm hoping our audience did too. My apologies for the technical difficulties that we were having. We will eventually get our arms around this, and because I like this panel format. I think there's plenty of expertise in this industry to share with each other and with our membership. So with that, I thank you all for attending, and I wish you farewell. Goodbye.